It starts with a little video, and that's a video with me explaining what we're trying to do and why you want to go there and how you can get the best from the practice. And then we've got 7 or 8 stages that we want you to go through. And step 1 is to turn around and say, what do you suffer with? What do I mean by that? Well, if you suffer with ischemic heart disease, then your GP practice notes should very clearly say ischemic heart. It should say that you've got that as a problem. It's very important that you do. If it doesn't, then you're not going to be called back again for various tests and investigations that we do for you. It's part of the recall system that GP practices have. So it's very, very important that step 1, that your medical record says that you've actually got a heart problem. And if you're not sure, then my recommendation to you would be to go in and ask your GP or nurse, can you just check, does it say that I've got heart disease? Does it say that I've got a problem with my heart? If it doesn't, then you've got to turn around and say, well, why not? Is that because there's been a mistake in the practice and we've not coded it? Or is it because I thought I've got a heart problem when actually I haven't? Okay. So step 1 is find out what is it. Now step 2 is find out what does it mean. And we've got NHS choices, the map of medicine, pathways for coronary heart disease, and summary information. And I'm going to come back to that in a moment once I've gone through the 7 stages or so. Step 3 is then to say, well, what help is there available to you? Often people think that the only person that they need is the doctor, when actually we've got a whole team of people around us. We've got nurses, we've got healthcare assistants who might be doing your blood tests for you and checking your urine and things. And this is to try and indicate the team of people in the practice that are there to support you. Step 4 is to ask, well, how are you doing? Often when we do medication reviews and I'm asking someone with heart disease, how are things? And they'll say, oh, I'm fine, doc. Well, what does fine mean? Is that okay or isn't it okay? What we're trying to do now is starting to describe what we as doctors use to try and assess your heart disease. And it might be around what your blood pressure is, what risk factors you've got, are you obese, do you smoke, do you have diabetes, is your cholesterol raised or not? And we're attempting there to get you to start to think about things in a way that's similar to us, using simple language. Step 5 is then to turn around and say, well, what needs to happen now and in the future? Traditionally, you're told you've got heart disease, you're suddenly told you've got an aspirin to take and a statin to take, and then nothing happens, you put your repeat prescriptions in, and then suddenly we're turning around saying to you, no, you can't have any more tablets, you've got to come in and have this test done and that test done and the other test done. Actually, you don't really know what's going on. So what we've tried to do here is start to describe, over the next year, these are all the things that we want you to do if you suffer with heart disease. So you've got some sort of idea of what's expected of you. How many times should we be checking your blood pressure, or how many times should we be checking it for you? How many times should you have blood tests done? How many times should we be checking your urine? It gives you some idea of what's expected. If you now know that you need your blood pressure checking twice a year and you need a medication review doing twice a year, you might then say, well, I don't mind doing it in March and September. I'd rather do that than suddenly be told a week before Christmas, when I'm really busy doing lots of other things, that I can't have my tablets because the practice suddenly decides you can't have them until you've had a medication review done. So we're trying to get you to understand what it is that you need to do on an annual basis, what's required of you, so that you can then have a conversation and say, well, I'd rather not come in December, I'd rather come in March or September or whatever it might be. What can you do to help? This is the bit where once you've understood what's expected of you, and then we try and explain to you, these are the things we would like you to do. So for instance, if you're coming for a medication review, it makes sense for you to have your cholesterol done first, your cholesterol, your lipid profile done first, check your diabetes status, check your blood pressure and things, get those tests done, and then you'll be able to then book in with the nurse, for instance, who can just make sure everything is as it should be. And if there's something that there isn't and the nurse can't resolve it, only then will the nurse say, come and see the doctor. You might then suddenly find that a lot of the issues don't actually require the doctor, and the nurse will be in a better position to sort things out for you. It might be that we want you to record your blood pressures if you've got a blood pressure machine, so that next time you go and see the doctor or nurse, you can bring a printout of all the blood pressures that you've been doing over the last X months or whatever. And then next step, up till now, all you've ever known about is your own heart disease. So you go in, you check your blood pressure, and the doctor suddenly says, or the nurse suddenly says, your blood pressure's too high, and suddenly you're being told to start new tablets and things. What you have no idea about is, well, how are all the other patients in the practice doing? Am I the only one that's got really high blood pressure? Are there other people who've got high blood pressure? Or conversely, how good is this practice? Is everybody's blood pressure really poor? So what we've done here is we've put together the data that's been collected on all the patients with heart disease in the practice, but made it available for you. So for instance, as an example, I've got here the percentage of patients with coronary heart disease in whom the last blood pressure reading measured in the previous 15 months is 150/90 or less. And we've got 89% of our patients whose last blood pressure reading is less than 150/90. Now, if your blood pressure is high, then that means that you're actually in the bottom 10 or 11%. No one likes to be at the bottom of the class. So the patient turns around and says, well, doc, why am I in the bottom 11%? All I could say as a doctor is, well, we're providing the same service to all our patients. Now that might get you to start thinking and say, oh, well, if you're providing the same service and I'm in the bottom 11, maybe that's something to do with me. And then maybe it's because I'm finding it really hard to take the tablets. Oh, why is that? Well, I keep getting side effects of the tablets that you give me, doc. And we get into a discussion that's not about my agenda, but it's actually about your agenda. How do we get your blood pressure back to where it should be? Or it might be that, well, doc, I'm finding it really hard, I'm really busy, so I end up going to McDonald's all the time and I'm eating all the wrong kinds of food, and that's the reason why my weight's not coming down, or whatever else it might be. It's a way of you finding out how you're doing compared to the rest of, not the population across the country, but this data is the patient population in our practice, the very patients who live in the same community as you do. And then the final step is, well, actually, if it's because of the way we've delivered services in a way that makes it difficult for you to access them, well, maybe you might want to change the way we're delivering services. And the way to do that is by something called a patient participation group, where a patient group and the practice come together to discuss issues to see how we might be able to improve things. And that's basically a framework for the way we are trying to improve the way we deliver services in practice. Now then.